Picture it, a tiny pill taken with a sip of water, quietly changing the pressure inside your arteries like a skilled technician adjusting valves in an old steam engine. That pill might be Lisinopril. And if you are taking it, today's story is for you. Because this video is not about fear, it is about awareness. 5 side effects to watch out for is really a promise. You will know what is normal, what is annoying, and what is a true emergency you never ignore.
All right, welcome back. If you're taking Lisinopril right now, here's the deal. It is one of the most commonly used blood pressure medications for a reason. High blood pressure is incredibly common as we get older, and it is sneaky. You can feel totally fine right up until you are not. So yes, controlling it matters for your brain, your heart, your kidneys, your whole future. But every medication is a trade. Lisinopril usually helps more than it harms, yet your body still deserves monitoring. Some side effects are just annoying, like a dry cough that ruins your sleep. Others are rare but urgent, like swelling of the tongue or throat that can block breathing. So here's how we are doing this. 5 side effects, clear symptoms, who is at higher risk, what to do next. And I will also bust a few myths that get people into trouble, like stopping the pill suddenly because of a symptom that was never dangerous. And quick plain English basics, Lisinopril is an ACE inhibitor. That means it relaxes blood vessels, lowers pressure, and reduces strain on the heart. Simple concept, big benefits. Now let's talk about what to watch for.
In the golden age of radio, the best stories had a rhythm, tension, relief, then a twist. Lisinopril has a similar rhythm in real life. Most people do well. Then a small symptom appears. The question is whether that symptom is a harmless extra sound in the orchestra or the first note of a different song entirely. Listen closely, and you will know which is which.
Side effect number 1, the dry, persistent cough. This is the classic Lisinopril complaint. Not a wet, mucus cough like a chest infection. More like a dry tickle in the back of the throat that keeps showing up, especially at night. Some people describe it like they always need to clear their throat. Why does it happen? Quick nerdy version, ACE is involved in breaking down a natural chemical called bradykinin. When ACE is blocked, bradykinin can build up in some people and irritate the airway. That irritation can trigger a cough. When does it start? Often within the first couple of weeks. But here's the trick. It can also appear later. So do not dismiss it just because you have been on Lisinopril for a while. What do? First, track it. Dry or productive? Worse at night? Any fever? Any wheezing? Bring that pattern to your clinician. If it is truly the ACE inhibitor cough and it is ruining your sleep, many people are switched to a different class, often an RB, and the cough settles. Important warning, if you have chest pain, fever, wheezing, or you cough up blood, do not assume it is just Lisinopril. That is a separate problem until proven otherwise.
The cough is dramatic because it is loud. It interrupts sleep. It steals attention. But the human mind is easily fooled. We fear what we can hear. The most dangerous problems are sometimes the quiet ones, the ones that do not announce themselves with noise at all. And that brings us to a side effect that can sit in silence while it loads the dice against your heart rhythm.
Side effect number 2, high potassium, also called hyperkalemia. This one matters because potassium is an electrical mineral. Your heart uses it to keep rhythm. Too much potassium can trigger dangerous rhythm problems, and here's why it is a trap. Many people feel nothing at first, no pain. No obvious warning sign. Sometimes the first clue is found on routine blood work. Who is at higher risk? If your kidneys are not filtering well, potassium can build up more easily. Risk also goes up with diabetes, dehydration, and certain medication combinations. Now, here are the real-life gotchas older adults run into. 1. Potassium supplements. People start them because they heard it helps cramps. 2. Salt substitutes. A lot of them swap sodium for potassium. Sounds healthy, but on Lisinopril it can backfire. 3. Stacking meds that raise potassium. Certain diuretics and other drugs can add to the effect. What should you watch for if potassium gets high enough to cause symptoms? Palpitations, severe weakness, feeling like your muscles are turning off, shortness of breath, chest discomfort. Those are not wait-and-see symptoms. Action plan, do your lab checks. I know, nobody loves lab work. But with Lisinopril, blood tests are not busy work. They are the early warning system for a problem that can be silent until it is serious.
In older medicine cabinets, danger often hides in the little extras, a supplement, a salt substitute, a familiar over-the-counter pain pill. Tiny choices that seem harmless can become powerful when combined. And our next side effect lives in that same world. Not always a catastrophe, often a normal adjustment, but sometimes a warning that the kidney's delicate balance is being pushed too far.
Side effect number 3, kidney function changes. This is where people panic and say this drug is poisoning my kidneys. Usually, that is not the right conclusion. Here's the truth. ACE inhibitors change pressure inside the kidney's filtering system. In plain language, they lower the pressure in the filter. That can cause a small early change in labs like creatinine or estimated filtration rate. A small bump can be expected. It can even be part of why these medicines protect kidneys long-term in the right patient. So, what is the key skill? Separating a small expected shift from a concerning change. A practical way clinicians think about it, a modest increase in creatinine soon after starting can be acceptable, especially if you're being monitored. But a big jump, a rapid decline, or symptoms of dehydration are a different story. Who is more likely to have bigger changes? People with chronic kidney disease, heart failure, volume depletion, heavy diuretic use, or narrowing of the kidney arteries. Now let's talk about the classic trap combination. Dehydration plus lisinopril plus a diuretic plus an NSAID painkiller. NSAIDs include common anti-inflammatory pain medicines people take for arthritis. That stack can reduce kidney blood flow and increase the chance of acute kidney injury. So what do? You respect lab timing. After starting lisinopril or changing the dose, follow the plan for checking creatinine and potassium. And if you get sick with vomiting or diarrhea and cannot keep fluids down, that is a moment to contact your clinician for individualized guidance, because dehydration changes the risk picture fast.
Now, every good broadcast has the moment where the music drops out and the announcer leans toward the microphone because there is a message that must cut through the noise. Most side effects we have discussed are call and discuss side effects. The next one is not. The next one is a red alarm.
Side effect number 4, angioedema. This is the one I never want you to ignore. Angioedema is sudden swelling under the skin, often the lips, sometimes the face, sometimes the tongue, and in the worst case, the throat area can swell in a way that threatens the airway. Let me be blunt. Swelling of the tongue or throat with trouble swallowing, voice changes, drooling, or any breathing difficulty is an emergency. Do not wait to see if it passes. Do not drive yourself. If you feel your breathing or swallowing is changing, get emergency help immediately. Here's another key point people misunderstand. Angioedema can happen at any time during treatment, not just the first week. So do not assume you are immune because you have been fine for months. How common is it? Rare. But rare does not mean impossible. And because the consequence can be severe, we treat it with maximum seriousness. If you have swelling limited to the lips and you are breathing normally, you still need urgent medical evaluation because it can progress. And after true ACE inhibitor angioedema, clinicians typically avoid that class again. This is not the symptom you push through. If you remember only one section of this video, make it this one. Sudden swelling of lips, tongue, or throat is not a wait-and-see problem.
The old public service announcements used simple language for a reason. In an emergency, complexity kills. When you smell smoke, you do not debate the chemistry of combustion. You leave. You call for help. Angioedema is the smoke alarm of lisinopril side effects. It demands action, not analysis.
Side effect number 5, low blood pressure symptoms, especially dizziness and falls. Yes, lisinopril lowers blood pressure. That is the point. But sometimes it lowers it too much, especially early on, especially if you are dehydrated, and especially if you are also on other blood pressure medicines or strong diuretics. What does too low feel like? Lightheadedness, weakness, dizziness when you stand up, feeling like you might black out, sometimes actual fainting. For older adults, the big danger is not just discomfort, it is falling. Here is a safe, practical response plan. If dizziness hits, sit or lie down immediately. That single move prevents injuries. Then track the pattern. Does it happen after taking the pill, after standing up, after a hot shower, after meals, or in the middle of the night when you get up quickly? If it is persistent, worsening, or causing falls, contact your clinician. Sometimes the fix is dose adjustment, timing changes, or reviewing the whole medication stack. Also, do not guess. Home blood pressure monitoring can help connect symptoms to actual readings. Use proper technique. Rest quietly. Sit with your back supported, feet flat, arms supported at heart level, cuff on bare skin. Take more than one reading and write them down. And if someone has severe symptoms like confusion, fainting with injury, or signs of shock, that is urgent care territory.
At this point in the program, the audience thinks they know the story. Then comes the myth segment, the part where bad ideas get dragged into the light. Because misinformation does not just waste time, it creates dangerous decisions. And with blood pressure medicine, one bad decision can undo years of prevention.
Quick myth busting, because these misconceptions wreck people. Myth 1. If I get a cough, I am allergic to lisinopril. Not usually. The ACE inhibitor cough is generally not a classic allergy like hives and itching. It is more like a chemical irritation effect. Still worth discussing, but it is not automatically an allergy label. Myth 2. The cough is dangerous. Usually it is not dangerous, just annoying. The danger is that it convinces people to quit meds abruptly. Myth 3. High potassium will always feel like something. Nope, it can be silent. That is why labs matter. Myth 4. If my kidney numbers change, lisinopril is harming me. A small early shift can happen because of how the drug changes pressure in the kidney filter. The question is magnitude, speed, and context, like dehydration or risky medication combos. Myth 5. Angioedema would happen right away. Wrong. It can happen later, which is why the warning stays forever. Myth 6. If side effects happen, I should stop the medication today. For most non-emergency side effects do not self-discontinue. The underlying condition still needs control. The exception is emergency airway swelling symptoms, where the right move is immediate emergency care. If you want a simple rule, annoying symptoms deserve tracking and a call. Emergency symptoms deserve immediate action.
And so we return to the central theme, not fear, but skill. The skilled listener hears the difference between static and signal. The skilled patient notices patterns early. A cough that will not quit, dizziness tied to standing, a lab value quietly rising, and, in the rare case, swelling that demands the fastest possible response. Awareness turns a medicine from a gamble into a tool.
Let's wrap it up cleanly so you can actually use this. If you're taking lisinopril, the 5 side effects to watch for are 1. Dry, persistent cough. Usually not dangerous, but it can wreck sleep, and it is worth discussing. 2. High potassium. Often silent. Labs catch it. Be cautious with potassium supplements and salt substitutes. 3. Kidney function changes. Small shifts can be expected. Bigger changes need evaluation, especially if you are dehydrated or stacking risky meds like anti-inflammatory pain medicines. 4. Angioedema. Sudden swelling of lips, tongue, face, or throat. If breathing or swallowing is involved, treat it as an emergency immediately. 5. Low blood pressure symptoms. Dizziness and falls matter. Sit or lie down right away. Track the timing and talk to your clinician if it keeps happening. And here's the calm truth. Most people do well on lisinopril. The goal is not to be scared. The goal is to be the kind of person who notices early signals and uses monitoring as protection, not punishment.
Medicines have always been a bargain with nature. We borrow a benefit, and we accept the responsibility to watch for the cost. Lisinopril often pays its benefit in quieter arteries and a safer future. Your job is simply to stay awake at the wheel.